Hello, everyone. Thank you for joining us today at our virtual reality naloxone training simulation webinar. As many of you know, we're thrilled to partner with Walmart to present this unique virtual reality training experience. We initially launched this simulation back in February 2020 at CADCA's National Leadership Forum. We then engaged with many of our amazing coalitions to learn how our communities can host events using this technology. We had incredible initial feedback, including how to use this VR tool as a standalone awareness event, how to create a training around it, or how to add it to trainings that are already being held in communities. Just as we were starting to host in-person events using the VR technology, we all know what happened and we moved to virtual everything. And while we're hoping that the last half of this year might allow us to have more opportunity to host events back in person, we're currently hosting virtually, and we are thankful to our amazing CADCA members, and specifically today, thankful to our good friends, Ms. Beverly Johnson and Ms. Kathy House, and the Alabama Opioid Overdose and Addiction Council for being our co-hosts. Before I kick this off to hear from our esteemed group of speakers, I want to let everyone know the goals for today. First, we'll hear from a wonderful group of speakers here in Alabama who are working every day to save lives and who we're honored to be part of this event today. Then, along with the Walmart Academy team led by Amanda Murphy, we'll view a few different virtual reality simulations that demonstrate a few different scenarios on how to recognize when an overdose is happening and how to administer naloxone. We'll follow along with the Academy lead who will be experiencing this training in a VR setting while wearing the Oculus headset. Lastly, we would love your valuable input today so we can learn from you how we could use this virtual reality technology in your communities. We plan to learn how to roll these events out nationally and roll this training out nationally. So we're trying to learn what we would need to accompany that goal. So again, we'd love your input. After we hear from our speakers and see the simulation, we'll have a few minutes for some guided Q&A. I'll ask a couple of questions at the end of the hour. And if you please type your answers into the chat, we really appreciate your input. We will continue to follow up with you in the weeks to come to get more input as well. And as always, you can reach out to us at CADCA at any time. Our president and CEO, General Barry L. Price, is typically our next speaker. Unfortunately, he's not able to attend tonight's event. He did, however, want me to express his apologies for not being here and also thank you for the work and the impactful collaborations you all are achieving throughout the state of Alabama. CADCA is excited to join today Commissioner Kimberly Boswell from the Alabama Department of Mental Health, Dr. Scott Harris, State Health Officer at the Alabama Department of Public Health, Steve Marshall, Attorney General of Alabama, Kerry Wimberly, Executive Director of the Addiction Prevention Coalition, Danielle Sims, who will share with us her personal experience, and of course, Amanda Murphy from Walmart. We're honored that you joined us for this training on virtual reality demonstration on how to save a life by reversing an opioid overdose. On behalf of General Price, I'd like to personally thank Walmart for their investment in not only this technology, but for their investment in the people who will benefit from this life-saving training. And a special thank you to everyone on today's webinar. We hope this unique event will train you on how state and local agencies are collaborating to combat the opioid epidemic in our communities. CADCA has a footprint in over 30 countries worldwide. We have more than 5,000 community coalitions across the United States, including this great state of Alabama. And we've sought to train community residents and leaders to build and develop coalitions in their communities and reduce substance use by adapting CADCA's model for community change. Recently, the CDC reported that 93,331 drug overdose deaths occurred in the United States in 2020. That's the largest number for a single year ever recorded. Think about that, more than 93,000 people. That number is roughly half the population of Birmingham. We wish each of you success in your direct communities, and we ask you to join us in becoming one CATCA. We cannot do this without you. You are the true heroes in your community. We're excited to be part of this event today with our partner Walmart, who's developed this virtual reality tool to deliver a powerful element to naloxone and overdose reversal trainings. It has never been more important to know how to save a life, and our coalitions are at the forefront of efforts in their community and making a tremendous impact. It's my pleasure now to introduce you to a special panel featuring the leadership of the Alabama Opioid Overdose and Addiction Council. Recognizing the extent of the opioid crisis, Governor Kay Ivey established the Alabama Opioid Overdose and Addiction Council on August 8, 2017, naming 3 co-chairs as council leadership: the Commissioner of the Alabama Department of Mental Health, the State Health Officer of the Alabama Department of Public Health, and the State Attorney General. The council was charged with the task of developing a comprehensive strategic plan to abate the opioid crisis in Alabama and established 8 subcommittees, each consisting of council members, additional experts, and community stakeholders to address the challenges of Alabama's opioid crisis. We will be hearing from all 3 leaders of the council today. Kimberly Boswell, Commissioner of the Alabama Department of Mental Health, has more than 36 years of experience in the field of mental health. The department annually serves over 200,000 individuals with mental illness, substance use disorders, and developmental disabilities across the state. The department's mission is to serve, empower, and support while promoting the health and well-being of Alabama citizens. Dr. Scott Harris was appointed Acting State Health Officer for the Alabama Department of Public Health in September 2017 and formally designated as Alabama's 12th State Health Officer in February 2018. Following an illustrious career that included serving as the medical director of the Decatur Morgan Community Free Clinic and serving on many international medical missions across the Americas and in Africa, Dr. Harris left private practice to join ADPH in 2015 as Area Health Officer for 7 North Alabama counties before assuming his current role as State Health Officer. Steve Marshall became the 48th Attorney General of the state of Alabama on February 10, 2017, following 16 years of service as the District Attorney for Marshall County. As Attorney General, Steve Marshall has embraced his role as the state's chief law enforcement officer and has committed himself to making Alabama a safer place to live. Mr. Marshall was recently elected to the Executive Committee of the Republican Attorneys General's Association, a nod to his demonstrated expertise and leadership on a variety of national policy issues, including the opioid crisis. We will now hear from the 3 co-chairs from the leadership of the Alabama Opioid Overdose and Addiction Council.
Good evening. I'm Kim Boswell, Commissioner of the Alabama Department of Mental Health, and one of the 3 co-chairs of the Alabama Opioid Overdose and Addiction Council. I'm excited to be a part of this virtual naloxone training event, helping to proactively prevent fatal overdoses in our state. Our mission at the Department of Mental Health is to serve, empower, and support. Programs such as this help to educate and engage the community and save lives. We are thankful to national and state mental health partners and to our large network of local providers and prevention agencies who offer essential resources to the communities. We are very concerned about the recent increase in overdoses. 1 life lost is 1 too many, and in 2020, there were 980 overdoses in our state. To help prevent death and overdose, the Alabama Department of Mental Health has made it a priority to ensure naloxone is readily available to the public. We began purchasing naloxone in 2017, and since that date, we have sent out over 19,000 kits. This year, we have mailed out over 850 kits a month. To address high substance use in specific areas of our state, the Treatment and Recovery Committee of the Alabama Opioid Overdose and Addiction Council. These programs include a statewide naloxone campaign where everyone can get free naloxone by completing a 10-minute online training by the Jefferson County Health Department. They will have a kit mailed directly to them to have in their home in case of an emergency. The committee has facilitated training and provided naloxone kits to first responders in 14 of the highest need counties in our state. In addition, we have created and distributed patient overdose prevention education materials for hospitals. At this time, we are developing a service locator app, which will allow someone to find a substance use prevention or treatment provider and make an appointment. This will be available later this summer. Naloxone can save a life and provide the opportunity for an individual to enter treatment where they can begin their road to recovery after an overdose. If you or someone you know needs naloxone, please reach out to us through the 24/7 helpline at 1-844-307-1760. If you have any questions or need additional information, please go to the Alabama Department of Mental Health's website at mh.alabama.gov. Thank you.
Hello, my name is Scott Harris, and I serve as State Health Officer with the Alabama Department of Public Health, and I'm also one of the co-chairs of the Governor's Opioid and Addiction Council. As we bring this message to you today in July of 2021, it's been a very difficult year and a half for all of us in this country and all of us here in Alabama. I think all of us are well aware that we've lost more than 600,000 Americans and more than 11,000 Alabamians to COVID, and yet we've seen many other consequences that weren't expected from a serious viral infection as well. We've seen vaccination rates among kids plummet of all ages. We've seen reduced cancer screenings in women not receiving pap smears and mammograms and other routine medical care. We've seen severe disruptions to our schools, to economic life, to our normal social networks. We've had many people enduring many months of isolation. And while our attention was taken away by all these things and we were looking the other direction, we've had another epidemic that's continued on unabated like it has done for many years now. Of course, I'm referring to the opioid epidemic. We've all been touched by this epidemic. Many of us have family and friends. We have members of our church and people in our workplace, members of our community who have suffered from this, and many of those people are no longer with us. We are just now beginning to understand that not only did the opioid epidemic never really go away, it actually gotten worse. It has actually gotten worse while our attention was elsewhere. We've seen in this country an increase of almost 29% in drug overdose deaths, with the majority of those being due to opioids just in 2020. Here in Alabama, our numbers are essentially the same, more than a 28% increase in the number of drug overdose deaths, with the majority of those related to opioids, particularly to fentanyl. This country is now seeing almost 250 deaths per day. And in Alabama last year, we had just under 1,000 total drug overdose deaths, about 980 deaths. At least 600 of those are known to be related to opioids, and it's certainly possible that there will be more as well as we get final data. We almost pulled together to do our part. This is an epidemic that's far-reaching and extends into every part of our state, into every community, into every home, into every family. The Opioid Council will continue its work, and we're particularly grateful to be part of this effort today that's sponsored by Walmart and by the Community Anti-Drug Coalitions of America. This is a way to reach out and save those people that we care about the most. Thank you.
I'm Alabama Attorney General Steve Marshall, co-chair of the Alabama Opioid Overdose and Addiction Council. I'm pleased to join my fellow chairs, Kim Boswell, the Commissioner of Mental Health, and Dr. Scott Harris, State Health Officer, in expressing gratitude to Walmart and the Community Anti-Drug Coalitions of America for developing this program aimed at saving lives. This virtual training for employees, first responders, and members of the public is a welcome addition to state efforts already underway to educate our citizens on how to prevent opioid overdose deaths. As Alabama's Chief Law Enforcement Officer, I'm keenly aware of the critical role that a rapid antidote response can play in preventing the death of someone who has overdosed on opioids. Since 2018, more than 30,000 doses of the overdose reversal drug naloxone have been distributed to non-EMS first responders, including law enforcement in Alabama. Given the state's ongoing epidemic of opioid overdoses, our first responders are very often the first persons to interact with their victims, becoming a literal lifeline. Not only must law enforcement first responders be ready to immediately recognize and respond to an opioid overdose, but in some cases, law enforcement themselves have been exposed to near-lethal amounts of opioids like fentanyl and carfentanil, requiring quick responsive treatment by their trained partners. The combined efforts of life-saving training, as well as the Stop Judging, Start Healing campaign, launched by the Alabama Department of Public Health and the Alabama Department of Mental Health to eliminate the stigma around substance use disorder and mental illness, are beginning to show a positive impact, but the work is just beginning. Even with all the attention paid to Alabama's opioid addiction and overdose epidemic, opioid overdoses in our state increased by 20% in 2020. I encourage everyone to take advantage of this virtual training to recognize the warning signs of opioid overdose and learn how to save a life. You can make a difference.
Thank you to Commissioner Boswell, Dr. Harris, and Attorney General Marshall for taking the time to be part of this event and speak with us today. And thank you for everything you do every day for Alabama. Now we turn it over to hear from Kerry Wimberly. Kerry has 25 years of leadership experience, communication, systems, project management, and grant management, combined with personal experience with youth battling substance use disorder. She's now focused on running a successful substance use disorder awareness and prevention nonprofit in Birmingham, Alabama, the Addiction Prevention Coalition. Her passion and personal mission is to discover creative ways to connect with today's youth and encourage healthy life choices and prevention to protect their future. I'll turn it over to you, Kerry.
Good evening, everyone. I'm Kerry Wimberly from the Addiction Prevention Coalition. So excited to be able to join you tonight and to tell you a little bit about our organization. I first wanted just to take just a brief second to thank Walmart for this very important event and education opportunity, and also to thank CADCA. We're a proud member of the CADCA organization and have relied so heavily on trainings and connection that CADCA has provided for us. I wanted to first just introduce you to the Addiction Prevention Coalition. We are a small nonprofit in Birmingham. Our organization is focused primarily on three things: awareness, prevention, and connections. We take a comprehensive approach with initiatives all the way from trying to reduce childhood trauma all the way through on the other side of recovery to supporting sober livings and other things in aftercare. But much of our work day to day is around prevention. We're proud to be a certified prevention provider for the state of Alabama. The first thing I wanted to talk to you about is our biggest awareness event, and that's our End Heroin Birmingham Walk. We've been doing this walk for 5 years in February, and that has become our signature awareness event. That event draws 3,000 to 4,000 people every year from around the state and beyond, and it hosts the largest substance use disorder resource fair in the state with upwards of 40 to 50 resources at the site at the same time. The purpose of that event is to bring awareness to substance use disorder in our community and in our state, but it's also to build relationships, to make connections, to recruit volunteers, and mostly to provide hope that recovery is possible and there is hope. And we love putting that event on every year. We also have started using technology to do awareness and also education, and that certainly has ramped up in this last year. during the pandemic. And you can see on this slide just an example of some of the things that we've been doing this past year. We just completed a really large effort with the Jefferson County Department of Health on the overdose issues in Jefferson County and encouraging people to get trained on Narcan. But the other things we use digital media campaigns, social media campaigns on, are positive social norm campaigns. We did a child abuse and neglect campaign with the Children's Trust Fund of Alabama. We did a tobacco-free campaign this summer. We're wrapping that up now, staying sober this summer. We're using this technology to reach people, and especially students, to reach them where they are, since they spend so much time on their electronics. Something we're really proud of is our student programs. We lead peer-led, adult supervised groups in high schools. We also have our Youth Advisory Council that are students that lead these groups, and also lead prevention campaigns in their schools and in their communities. We have teen mental health first aid that we're kicking off this fall, and excited about that. Our students do community service opportunities around the state. And also we have a community coalition that works on environmental strategies. We also spend a lot of time in trainings. We do what we call Prevention Partners, which is a workplace training to actually just break stigma, to have the conversation about the fact that all of us have relationships with substances, and we want to keep those relationships healthy. We're doing a lot of mental health first aid with adults and with adults that are working with students. We also do prevention education for teachers and administrators, and now we're moving into athletics, where we'll be training high school athletes and their parents and the coaches, and we're so excited about that new initiative. So more than all of these things that we're doing, we have come to understand the beauty of collaboration and the beauty of connection. And we try to be a connector of people needing resources. And also we try to connect to organizations that are already doing the work on the ground and come alongside them and support them. So invite you to find out more about APC. My contact information is on that slide, and would love for you to check out our website. There's resources there, and also to connect with us on Facebook, Instagram, and LinkedIn. Thank you so much for your time.
Thank you so much for those remarks, Kerry, and for helping us to better understand some of the really impactful work you're doing in Alabama. And thank you mostly for your friendship with us at CADCA. And now it's a pleasure to introduce Danielle Sims. Danny is a person in long-term recovery and works as a certified peer support specialist with the Recovery Resource Center, a program of the Crisis Center. Her aim is to help those struggling with substance misuse by instilling hope and advocating for harm reduction. We'll now hear from Danielle.
Hi, I'm Danny, and I'm a person in long-term recovery. I'm no longer enslaved to my addiction, is what that means to me. Specifically, my opioid addiction, but all of it. I was a poly user. But opioids were truly the thing that I couldn't let go of, that held me like nothing else had before. And opioids are the reason that I almost died several times. I'm an overdose survivor of multiple overdoses. And a couple of those times I was revived with naloxone. The time that stands out the most to me was one day when I was pulled over in a parking lot of an apartment building, and I had just used an opioid, a very strong one. And the next thing I knew, I was laying on the pavement, and there were paramedics all around me, looking down on me from above, and they were trying to get me to talk to them, and my words were not coming out the way I was thinking them in my head. Like, my words weren't matching up with what was going on inside. and they told me that I had been revived with naloxone, and that a lady saw me in my car, with blue lips, with my door locked, and she called 911. And so that was the first day that naloxone literally saved my life and reversed an opioid overdose for me. Happened again the next day. It kind of happens that way for some of us. You know, it's not just a one and done. For me, I was revived again the next day by another group of paramedics. I went on to continue to use opioids for 3 years after that. I was just not able to let them go. You know, that's the plight of addiction. Once you're hooked, it's so hard to let go, even after, you know, near fatal experiences. So after 3 years of struggling and wanting to stop and not being able to, I finally found a way out. It was very difficult. It was very hard. I'm not going to sugarcoat it. It was. But the thing that really changed it for me was I stopped trying to do it my own way, and I listened to someone who had been through what I had been through before, and it helped me to get free of my addiction. You know, and it's been 4.5 years now that I've been in long-term recovery from everything, specifically opioids, and I've never felt so free in my life. Today I work for the Recovery Resource Center. It's part of the Crisis Center here in Birmingham. And I'm able to talk to people who are just like me, who did the same things I did, and who felt the amount of hopelessness that I felt, who've overdosed or maybe who haven't overdosed, but people who just feel as if there's not another chance for them. And I'm able to give them a little bit of hope. And when they're not always ready, you know, maybe they're just scared when they come to us. I can aid them with harm reduction because, hey, that's the most important thing, right? Is keeping our life so that when we are ready to change, that we're still alive and able to do so. Like I said, I didn't stop using when I first got naloxone revival, but if I wouldn't have been revived on those days, I would have never gotten to the point where I was able to actually change my life. You know, like sometimes we just have to help them along the way until they get there. And so, yeah, that's my spiel.
Thank you, Danny, for sharing your touching story. Thank you for the work that you're doing now to help others. Your experience and your success reminds us how important all of this work is that we're doing. And you remind us that there is always hope. And so we appreciate that. Finally, I am going to pass this to our helpful partner, Amanda Murphy, and the team here at the Walmart Academy, who will walk us through the virtual reality simulation. The Academy team will wear the headset and allow us all to experience the virtual reality demonstration along with them. Amanda?
Thanks, Reiko. My name is Amanda Murphy, and I'm a senior manager with Walmart's Academy Operations Support Team. Walmart has invested in our associates by creating the academies, which are dedicated facilities for hands-on training that combine classroom and sales floor training for our associates. The academies also partner with our communities in various ways to provide continuous learning opportunities. One of the ways we can provide content for our participants and our community partners is through virtual reality. VR helps us recreate situations that aren't easily replicated in the classroom or in the sales floor. I'm now going to turn it over to the Academy team in Wetumpka, Alabama, who will demonstrate how to leverage VR. Matt and Sabrina, over to you.
Dude, guess what I just swiped for my grandma?
What?
Don't people get strung out on this stuff?
Yeah, that's the point.
These two industrious young gentlemen have stolen opioid medication for recreational use. Oxycodone, hydrocodone, fentanyl, and heroin are a group of chemicals referred to as opioids. The first three may be prescribed by a medical professional to treat pain, but they can be addictive and deadly, especially if not taken as directed. Heroin has no legitimate medical purpose. Opioid overdose is the current leading cause of death for people under 55. True or false? More than half of Americans have been affected by opioids. Correct. Over 70,000 people died of opioid overdose in the United States in 2017. And millions more were impacted through overdose or misuse. That means that if you have not been directly affected by opioids, someone you know likely has. But not every overdose needs to end in death. Today we're going to teach you to spot the signs of an overdose and administer naloxone, a life-saving medication.
Hey. You okay, dude? You don't look so good.
Opioid overdoses will slow or stop your breathing. This reduces the amount of oxygen in your body, resulting in pale or clammy skin. The pupils will constrict until they are the size of a pin. The lack of oxygen can cause the fingers and sometimes lips to turn blue, gray, or purple, depending on the person's skin tone.
Your breathing is weird. It's too slow.
A very serious side effect of opioids is depressed breathing. During an overdose, their breathing will become shallow, erratic, or stop entirely.
Yo, Jay. Jay. Wake up, man. Wake up or I'm calling the cops. John. Hey, I'm not playing with you. Are you breathing? Dude, you're not breathing. Jonathan.
Loss of consciousness is the final tell of an overdose. If you suspect someone is passing out because of an overdose, you should scream their name and try to wake them to see if they will respond. As with any emergency, the first thing you should do is call 911.
911, what's the emergency?
Yeah, hello? I need help.
Naloxone is a life-saving medication that can reverse opioid overdose and restore breathing. There are several types of naloxone available, and all of them provide a life-saving medication in the event of an opioid overdose. In the example today, you will see the nasal spray Narcan administered. If you happen to have the injectable form, make sure to hold the needle straight and inject it into a muscle, like the shoulder or the upper thigh. First, peel back the packaging to remove the device. The device has a plunger and a nozzle. Hold the device with your thumb on the plunger and 2 fingers on the nozzle. Be careful not to accidentally spray the naloxone before you are ready. The device only has 1 dose, so don't test it out. Put the device right up their nostril until your fingers are touching their nose. Press firmly on the plunger to release the dose of naloxone.
Come on, buddy. Wake up. Come on, man, wake up.
After you administer naloxone, place them in the recovery position and wait for help. The person who overdosed needs immediate medical care. You should stay with them until help arrives in case they lose consciousness again. Another dose may be necessary.
There you go. There you go. All right, that's it. Welcome back.
Great job. When people think of overdose, they usually think of recreational opioid use like we saw here. This is a stereotype, and unfortunately, there are many situations that lead to accidental overdose. Let's take a look at other situations that can lead to accidental overdose.
Mom? 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 Mom, wake up. Mom? Not again. My mother is blacked out. I think she's had a heart attack. Send an ambulance.
Please stay calm. I'm going to check her vitals. What's her name?
Blanche.
Blanche, I'm here to help you, okay? Is that hers? I'm going to check her for an overdose. She's got a pulse, but her breathing is slow. Let's check her pupils. All right, stay with me. Uh-oh, they're constricted. With this medication, this may be an overdose. Let's administer naloxone. All right, Blanche, stick with me, okay? 1 second. All right, I'm just gonna go right up here. The patient took too much of her prescribed medication. She forgot that she took her medication before breakfast and took another dose after breakfast. In the event that this had been a heart attack, naloxone wouldn't have been able to treat the heart attack, but it would generally be fine to administer to her without serious complications. Talk to your healthcare provider or check the package insert for possible side effects and additional information. All right, Eugene, got your stuff. Oh, no. Eugene took an old opioid medication that he had previously been prescribed for pain. Usually this wouldn't cause an overdose, but he's taking a new benzodiazepine medication. When opioids and benzodiazepines mix, the results can be deadly. Always check with your doctor or pharmacist before taking any medication, just in case there will be a negative interaction with your other medications.
Sending an ambulance right away.
Opioid overdose can happen to anyone. You can overdose from opioids even when taking a prescription exactly as your doctor prescribed, which is exactly what happened to me.
All right, hotshot. I hope you're paying attention. It's your time to shine. Select the things you should look for when you suspect an opioid overdose. Now, let's review how to administer naloxone. Correct. You have to remove the device from its packaging. It will not do you a lot of good otherwise. Correct. That's how you hold the device. That's correct. You did it. You saved my life. Thank you for knowing what to do in the event of an opioid overdose. Accidental overdose can happen to anyone taking opioids, whether recreationally or even as directed by a doctor.
This information can save a life. Opioid misuse is a national epidemic, and accidental overdose can happen to anyone taking opioids. It takes an entire community to keep all our members safe from overdose. If you or someone you care about is taking opioids for any reason, consider getting naloxone at your local pharmacy and keeping it on you at all times. No prescription is required, and it could save your life or the life of someone you care about.
Thank you so much to the Academy team for helping us with the demonstration today. And thank you so much to Walmart for hosting us. And thank you so much to Beverly Johnson and to all of the speakers here today who have taken time out to be part of this event. So now we have about 15 minutes left, and we would love to get some feedback from you guys who are joining us today with some quick Q&A. I'm going to ask a couple of questions, and we'd love if you would respond by using the chat. Again, we only have about 15 minutes left, and I know we're going to get a lot of amazing feedback. So please know we're monitoring the chat. If we don't get to you, we will be following up with you. And you can reach out to any of us at CATCA at any time for more information. We want to hear from you, and we will be providing more opportunities to learn from you. So again, if you want to just go ahead and place your responses in the chat, we'd love to get this info from you. And just some thoughts, just a quick discussion. So our first question would be, what are your suggestions for the best way that you as community leaders might use this VR simulation? What might be some ways that you would use this in your community? We've had different responses. People have told us they thought it's really important. They could use this to help remove the stigma associated with addiction, to educate the general population just about to bring an understanding of addiction and how to help someone, a loved one who might be experiencing an overdose. Okay, it would be great to show this training in a coalition meeting or with some community partners. What is the typical response rate post-administering, and when should a second dose be administered if the person remains unconscious? So I think that is remedy to all panelists. Yes, hi. So I would love to just pose that a little bit to the chat, but other than that, I know a member from our CADCA team can follow up with you and really give you that sort of information. And we'd be happy to just kind of reach out to you and talk to you about this. Great video, and bless each of you for this public awareness. Well, thank you. You guys have a video that is school friendly. So Angela, reach out to us at CADCA. We'd love to talk to you about that and you know what your needs are and how we can maybe help you with this. Okay. So I'm going to go to another question while you guys are just kind of thinking about this. This training will work with first responders in the community. Yeah, it's a great idea, and we're hearing that a lot. How can you use this VR tool for training or events that you might already be hosting or that you might be creating? And what are some other ways you think that this might be, we might be able to use this just to reach more people in the community? I mean, you guys are just amazing with who you reach. But are there some gaps, or maybe this could be helpful to train even more people in the community or make more events, even like we're doing this, but doing them in person? And some responses we've had is include the training in other languages, help use this to talk about what your state is doing with naloxone, which I think is really important. And one of the things we've been doing with all of our states is really helping to get the information out about what's been going on in the state around training events in naloxone. It can be a great training for caregivers. That's really important. I've also heard grandparents, right? Because so many grandparents are caregivers. Thank you, Sean. Remedy there. Okay. Train foster parents. That's really important. So let's go into, we'll just keep going, youth summer camps. What are some efforts or local efforts that you are aware of where you can use this to help engage more people in naloxone education? So I think we've gotten some of these youth summer camps, foster parents, we've gotten county and state fairs, we've gotten health fairs, PTA meetings and parent workshops, church events, back to school meetings, training within the Alabama School of Alcohol and Other Drug Studies. Yes. I think that's great. And we should definitely follow up to see what events you have that we can continue to host some of these events and host these trainings. Community outreach events. Great. You guys are really adding a lot of important feedback. What training sites or groups need this training the most? Who's the most interested? And we've gotten, again, the gaming community, casinos, college recovery, small businesses, high school health class. Can you guys think of anything that you know in your communities where what groups might need this training the most? We've had volunteer fire departments, which I know is something that we're really thinking about. PAL groups. So can you put out what PAL is? College students as they go out on their own. Yep. Okay, great. And I think the parents of addicted loved ones, yes, absolutely. Thank you for that. How can we as a coalition get access to the virtual reality training? Just reach out to us. We will follow up with you and get you more information about that. Freshmen starting their first year of college, absolutely. Okay. So one more question I'm going to ask is, where are the gaps in your community? I would ask you if you guys can think about that. And it's not just where we can educate and train more individuals who need to know about naloxone, who should have naloxone, and how do you use it. But I think we'd also love to know, are there people in your community who need naloxone but can't access it, or they don't have enough of a supply of it? For example, volunteer community health workers, volunteer fire departments, shelters, community programs. Do you know of places or gaps in the community where there isn't enough supply of naloxone? And I know some of these you just might not be thinking of right now, and it's the last minutes of this webinar, but we're going to be following up with you, and Sean's going to put all of our emails in the chat. So please, if you're thinking of this, just follow up with us. We get all sorts of emails afterwards with amazing feedback, so we'd really love to hear from you. Then lastly, we'll be saying we really have some other questions that we've been asked, and we're thinking about how to do this. How do we reach populations where English is their second language? I think that's really important. Are we considering trainings to local shelters, which I know a lot of what we've learned about is there's a need for that as a community. So really, we're just thinking of these, and you guys have just such tremendous feedback. Okay, so with that, I think that we want to just say we're going to extend our thanks to all of the speakers and participants for attending this event tonight. We truly appreciate your time, and we really appreciate the work you do at the community level and your insights. Again, please reach out to us at CADCA anytime with more suggestions and questions. Look for us to be reaching out to discuss this more and get your tremendous feedback. Great presentation. Well, thank you. And thank you so much for taking time out of your evening to attend. We really appreciate it. We are going to go ahead and conclude the evening. We appreciate your time. Have a wonderful week. Thank you again, and have a great night, everybody.